Hello everyone, and welcome to today's webcast. Today we will be discussing how health insurance organizations can utilize market data more effectively to make data-driven decisions and discover cost-saving insights. Before we get started, I would like to briefly introduce myself as well as my fellow presenter for today. My name is Grewal, and I'm joined by my colleague Laura Haase. We are both business intelligence and analytics consultants at Thorogood, and we help our customers deliver end-to-end business intelligence solutions. We have a few main objectives that we plan to cover today. First, we want to discuss the importance of becoming a more data-driven organization in the context of the health insurance industry. Then, we will demonstrate a few use cases of how health insurance companies can use market data to better understand their members and identify some cost-saving opportunities. And then throughout the demos and presentation today, we will share more about how pairing Tableau and Excel with Microsoft Analysis Services can help equip more users in your organization with the tools that they need for self-service analysis. To start off, we'll begin with the brief introduction of Thorogood for those of you who aren't familiar with who we are and how we help our customers. Then we will discuss the importance of data-driven decision-making within the health insurance industry and the value proposition around integrating market data. After that, we will move quickly into some demos in Tableau and Excel around two specific use cases. The first of which will highlight the dashboarding capabilities of Tableau and how guided analytics can be used to uncover cost-saving insights through market comparisons. And then we will show the more self-service functionality available with Tableau as well as Excel, looking at specific member populations. Throughout the event, we plan to discuss the benefits of pairing Tableau and Excel with Microsoft Analysis Services to address the wide array of reporting requirements. And then finally, we will summarize and wrap up everything we covered in the webcast. So moving on to about Thorogood. We are an independent consultancy specializing in business intelligence and analytics with over 25 years of experience. We work with some of the leading organizations in the consumer goods, pharmaceuticals and life sciences, insurance, and banking industries, delivering solutions globally with consultants based in the United Kingdom, United States, and India. We help these customers with a range of services that cover the end-to-end life cycle of a project. We blend business understanding with strong technical aptitude and a deep understanding of analytical tools and techniques as highlighted in the intersection of the three circles in the top right. This intersection plays a crucial role in our ability to deliver high-quality business intelligence solutions. So as I mentioned, we are an independent consulting firm, so we aren't limited to one specific technology vendor. Rather, we work with a wide array of technology firms within the business intelligence and analytics space, including some front-end, back-end, and analytics-driven technologies, which allows us to customize our approach to a solution to fit any client's needs. And for today, we will be focusing on our partnerships with Microsoft, specifically Analysis Services, as well as Tableau. With this cross-platform knowledge and partnership, we develop well-rounded expertise that allows us to successfully integrate tools together to deliver the most value to our customers. Analysis Services is a powerful tool that gives organizations the ability to create a robust data layer that supports a variety of business goals and complex reporting requirements. Tableau is an industry-leading data visualization software that is enabling more organizations to shift from traditional tabular reporting to more intuitive visual dashboards. In addition, Excel is one of the most commonly used tools by analysts within organizations, and it allows them to conduct more of an in-depth ad hoc analysis. The pairing of these technologies allows businesses to create IT-supported dashboards as well as self-service reporting from a single data source, ensuring a single version of the truth. And with that, I'll hand it off to Laura, who will start to take a closer look at the health insurance industry and some specific use cases for integrating market data.
Thank you, Greg. So when thinking about analytics as it pertains to the health insurance industry, we thought it was important to first review some of the key impactors in the industry and how different factors are changing the way insurance companies operate. One of the most prominent factors impacting the industry is the Affordable Care Act. While there are mixed opinions on the law, everyone can agree that it has caused major changes for health insurers and providers. The mandate for universal coverage creates a need for companies to understand their new membership populations, analyze the data that's collected on them, and adjust their prices and products accordingly. In order to efficiently adjust their business practices, organizations need to empower more users to make data-driven decisions. Another key factor, certainly not specific to the health insurance industry, is the availability of information. There are a variety of data sources available, including data collected about competitors in the market, and with the advent of electronic medical records, providers are collecting even more information about patients and members. Given the influx of data, there is an increasing amount of analysis that needs to be done, creating a need to empower more users. It is important that business intelligence solutions equip users with the tools they need to do their analysis without jeopardizing the security of sensitive personal health information of their members. Additionally, industry consolidation is happening at every level of the healthcare industry, with insurance companies merging and healthcare systems acquiring hospitals and providers. This is changing the competitive landscape that insurers are operating in and creates a need for insurers to better understand their market position and to remain competitive. Finally, from a political perspective, this is an important presidential election year in the US, and healthcare has been a huge topic for debate among candidates. Healthcare organizations have already started to make the required changes mandated by the Affordable Care Act, but the changing political environment could have an effect on additional future changes. The combination of all of these factors, as well as others, are driving the need for health insurance companies to have users that can analyze the large volumes of data that they're collecting and be able to make quick decisions based on that analysis. Given all of the factors affecting the health insurance industry, it's important that health insurance companies become more data-driven organizations. So what does it look like to be a data-driven organization? With many of our customers, we see the use of operational reports that are highly structured and fairly stacked. These reports are typically emailed and give end users limited interactivity with their data. While they may be great for providing a snapshot of their data, these types of reports can often spark further questions for end users in which they may want to do a deeper dive analysis. In addition to these reports, we see our customers creating dashboards, shifting away from often tabular reports and utilizing more data visualization. Dashboards also have more interactive functionality, giving users the opportunity to use guided analysis to get down to granular levels of detail in their data to find interesting insights. What we're seeing an even bigger need arise for with our customers, particularly in the health insurance industry, is self-service. While the operational reports and dashboards answer some questions users have, it is nearly impossible to develop a solution that answers all possible questions that arise. Giving users access to the data gives them a chance to perform root cause analysis and investigate specific questions that they may have. We find that there is benefit to all three reporting options, and that it is a spectrum of maturity for users. Keep in mind that operational reports typically have more of an IT dependency, whereas the self-service content creation is driven by the business users. Regardless of the report type, there is support required from IT to ensure the data is modeled appropriately for reporting. It is important that business users mature over time and more users will be able to do self-service analysis, especially in the health insurance industry, given all of the factors we identified in the previous slide. Notice that while these report types are bucketed, they are not mutually exclusive of one another. Rather, users will use all reports at their disposal to reveal actionable insights in their data. In addition to enabling more self-service analysis, health insurance organizations should also consider the benefits of integrating market data given the volatility of the industry. Organizations will have some form of business intelligence and analytics that they use to get insight into their business. However, the changes in the competitive landscape and increased regulations create the need to have insight into their business relative to the market. Therefore, integrating additional sources of information, in this instance market data purchased from a third-party vendor, enhances the current solutions. This will result in an increased understanding of the market position and reveal cost-saving opportunities for health insurers and their members through activities such as directing customers to more cost-effective centers of care. While we will be highlighting two specific use cases today, integrating market data can help answer a variety of questions, including some more generic questions like, how am I performing relative to my competitors? And what opportunities exist to lower my claim costs? As well as some more specific questions such as, where are my most cost-effective centers of care? And are there any specific member populations that are more expensive than others? And if so, how do I adjust my products and services to take all of this information into account? With that, I will hand it back off to Greg, who will take us through our first demonstration for today.
Thank you, Laura. So to quickly revisit the spectrum that Laura touched upon a few minutes ago, for this demo, I'm going to focus on the dashboard section as I highlight here. For the following demonstration, we will be utilizing some simulated internal and market health insurance data and use that to help uncover some cost-saving insights. And throughout this walkthrough, I plan to touch upon the following: how market data can be used to enhance analytics, how dashboards and guided analytics can help users discover meaningful and actionable insights, and how Tableau Server can be useful for distribution and providing guided analytics. So with that, I'm going to jump over to Tableau. Okay, so here we are in the web browser. So this is Tableau Server, but it's important to note that this dashboard I'm about to walk us through was created in Tableau Desktop and then uploaded to the server so it can be accessed by other users or analysts within an organization to study and draw some conclusions. So if we look at this dashboard, on the right-hand side we have some filters, and for this specific page we have year and region. And we can select whichever region or year we want to look into, but for right now I'm going to leave it with the Northeast in 2016. And we can see that in the top left we have a map that shows bubbles for each state within this region that I selected. So if we take a look at this, we can see that the size of the bubbles is dictated by the claim count. So the larger the bubbles, the more claims that have incurred within this state. So looking at this, we can see that looks like New Jersey and New York have the highest claim counts, close to 10,000 in New Jersey and also close to 10,000 in New York, but we can see that it's slightly more in New Jersey. And then the colors dictated by the internal PMPM. So a lot of you may be familiar with the PMPM and the difficulties that come with calculating it, and Laura will take us through how using Microsoft Analysis Services can help. But for now, just know that that's what dictates the color of these bubbles. So we can see that New Hampshire looks like it has a dark color with a PMPM of a little over 15,000, and New Jersey looks pretty dark as well. PMPM 14,000, a little over 14,500. So maybe it's something, New Jersey might be something I want to look at in the future because it has both a high amount of claims and then a high PMPM. And then looking over here on the right side of the page, we have a bar and line chart. So this shows our internal PMPM trend over time and how we compare against the market. So the light blue bars here are internal PMPM. So we can see that these numbers are significantly higher than the market for the first 6 months in 2016 for all the states within the Northeast region. But if I were to click on something like, let's look into Pennsylvania, it has a light color, so maybe we'll lower PMPM, maybe we trend closer to the market or maybe even below. So as this loads, you can see that we still trend a little bit higher than the market, but we're a lot closer. So even though that this is a small dot and a light color, it's still something that can be looked at in the future as a possible cost-saving opportunity. And then as you also notice, when I clicked on Pennsylvania, we have a table that populated beneath, which shows our information by providers within this state. But as you can see, we have providers that are outside of the state of Pennsylvania. And it's important to talk about this because our provider information is dictated by our members, not by our state. So in theory, if someone needed medical attention, they wouldn't necessarily stay within the state to go to the best provider. So hypothetically, if University of Maryland Medical System, as we see here, was one of the best hospitals for something that someone needed to get done, they're not going to necessarily stay within Pennsylvania for that to happen. But I actually want to switch over to New Jersey because as I said before, it has the largest circle that we see on this map, also with a very dark color. So it's something that we want to look into because as you can see, we trend a lot higher than the market, and a lot of claims with a high PMPM indicates a large amount of losses within this state. So if I direct our attention back towards this table in the bottom, we can see that we have the claim count and then the internal PMPM as our first two columns of the table, give us a little bit of background information of what's happening within these providers. But then we also have something called charge per claim. So this is one of the first issues where we run into problems integrating our market data with our internal data. We have different levels of granularity, so it's kind of hard to compare across some of the metrics that we would usually be looking at. So like, for example, if you remember, if I hover over this dot in New Jersey, we can see that our PMPM charge is almost $15,000, whereas each provider, or the top 10 providers that we have for these New Jersey members, the PMPMs are in the hundreds. And this is because we have this data all the way down to provider level, so our PMPM overall in the state gets divided across these providers. But we can't do that with the state or the market data, because we may not necessarily have the provider information, maybe sensitive information that they don't want to, or that's not okay to sell to other companies. So this is not something that we have access to. So we had to figure out a way to normalize our data, be able to compare our market internal data so we can see where we're trying to higher or lower and have these comparisons. And that's where charge per claim comes in. So what we have is we took the charged amount, the amount that we paid out within these states, or these members within these states, and then divide it by the amount of claims. We have these red triangles if we trend above the market for the charge per claim, and then the green triangles that point down if we trend below. And then the shade indicates how much higher or lower we are. So for example, at Albert Einstein Medical Center, we have a very deep green here, so we trend by this number over here, we trend $4,605 below the market in our charge per claim. Whereas for New York University hospitals, we have a much lighter green. We trend below the market by a lesser amount than of Albert Einstein. So we can use those shades to help us get a better idea of where we are, just at a quick glance. But if I take a look at this, I can see that, let's look at St. Peter's University example, for example. We have pretty high claim count, one of the higher ones within this list. Looks like the highest internal PMPM, and a pretty dark red triangle. So maybe this is something that we want to look into because we have an opportunity to save some money here. So I can click on this provider, and it will automatically take me to the next page within our dashboard, which is going to show provider details. So as it loads, you'll notice that we have a horizontal bar chart that compares ourselves to the market. So we'll have a quick glance. We can see if we trend higher or lower based on the color. So if we look at this this legend over here, we can see all the major diagnostic categories, but I'm going to refer to them as MDCs from here on out. It's a little bit easier to say. But if we can see that these are the 4 that we have data for within this provider, St. Peter's University. And it's important to remind you guys that this is mocked up data. So this isn't real, that St. Peter's University Hospital only has these 4 different MDCs. There'll be much more. But for the sake of this demonstration, we can assume that these are what they offer, and we can see that, for example, transplants have a much higher charge per claim than the market, and that's something that we might want to look into. But I can look into this a little bit more, maybe if I want to see if there's like a specific procedure or something that drives up this cost, or if there's a bunch. So what I can do is I can drill into this, and by clicking this drill button, and what's going to populate as it loads is we're going to see the diagnostic related groupings, or DRGs as I'll refer to them, that comprise these MDCs. And same coloring as before, and I'm actually going to sort this to sort it based on the value of our internal charge per claim, get a little bit better look at it. And we can see that under transplants, for example, it's not just one specific DRG that causes this spike. We have 002, for example, 004, 003, and 007, which are all higher than the market significantly. If we look at 004 and 003 here, we can see almost $50,000 difference here. So these may be something we want to look into. So if I were to click on this transplant MDC, it'll take me to the final page within our dashboard, which shows this specific MDC category within, or in a little bit more detail. So we can see that we have in the top, we have this chart here, this horizontal bar chart, which shows our claim count on the left for each DRG within this MDC, as well as essentially the same chart as the previous page, just so we have this background information to look at again. And looking at this, I didn't necessarily point out that 002 was significantly higher than the market on the previous page, because we only have a little bit of a difference, but we have a very high claim count in comparison to the others. So just because it's a small difference, it can be multiplied over this multiple claim counts and cause higher losses within our St. Peter's University provider. So what I can actually do with this is I can look into like a what if analysis to see how much I could potentially save. So I can select DRG 002 in this filter over here, and as it loads, you'll be able to see that I can look over into this what if analysis in the bottom left-hand corner, and I can decide that if I want to change the PMPM by a certain percent for this specific DRG. So if I want to go for maybe even just, we see up here that we don't have that big of a difference, so maybe just 1%, so minus 1% change in our PMPM. And then I can see that over this time span of 2016, I could have saved $42,440. And it's important to note that this is a little bit of a retrospective analysis. We're taking our previous data and seeing how much we in theory could have saved, and we can use this to apply in the future to potentially save close to, if not more, hopefully. I also pointed out before that 004 and 003 had the really large difference between our internal markets. So maybe if I want to look into, let's go with 3. And I can change this. So looking in this, we have much bigger difference. So maybe I want to do like let's say change it by about 20%. And we can see that this changes it by almost $44,500. And this is important to note, even though we changed the 002 by 1% and this one by 20%, it yields almost the same savings. So it's definitely useful to look into something that may not even have the biggest difference, but a higher claim count, just get a better idea of what's happening. In our final visualization in the bottom right hand corner, we have what's going to we can point our members to the most cost-effective providers. So for example, for DRG 003, we can look at these bubbles that show the the providers based on their charge per claim. So if I look at this, we can see that the size is based off of claim count. So the larger the bubble, the more claims. So for example, if I'm living in New York, I can see that New York Presbyterian has the lowest charge per claim, as well as a couple claim counts within our data system. So it might be something that we might want to point our members to go take for DRG 003, whereas maybe somewhere in New Jersey we see that the lowest is St. Francis Medical Center, but there's less claim counts than Robert Wood Johnson University Hospital. So maybe we want to direct our members to Robert Wood Johnson University because this is somewhere where this DRG happens more often, and both of which are fine because we see that the average market value is here with these lines. So we can, as long as we keep them beneath the market value, we are effectively saving money for both our members and ourselves. And one last time, it's important to point out that this is mocked up data, so these values are not necessarily correct for all these providers. Just keep that in mind. This is just a couple intersections within the data that we have, but as you can see, and I pointed out before, with, for example, Pennsylvania on the map, there's plenty of other places in which there are possible cost-saving insights. So if in the hands of an analyst within an organization, this can be used to uncover many potential cost-saving opportunities within an organization. So to summarize this demo, a few of the things that I covered were how market data can be useful to augment reporting and understanding of the competitive environment, how dashboards and guided analytics can help uncover some cost-saving opportunities, and then how Tableau Server can be useful for distribution and providing guided analytics within an organization. And with that, I'm going to pass it back off to Laura for a more ad hoc type of reporting analysis.
Thank you, Greg. Before we jump into the second demo, I want to take a step back and share a bit more about how we're using analysis services to meet a variety of reporting needs that we have. Note that in Greg's demo and my demos today, we are using an analysis services model as our data source. As with any reporting solution, there are a variety of sources of information. In a traditional BI solution, front-end tools are often sitting directly on top of these data sources. However, issues can arise when trying to perform complex calculations like per member per month or PMPM, and trying to integrate data at different levels of granularity, such as the provider information only being available for internal data. Analysis services acts as an additional layer where business rules and logic are added to take into account these reporting requirements and relationships. Then, Tableau is connected directly to analysis services, ensuring accurate calculations for both dashboards and self-service analysis. It is important to also call out that other tools such as Microsoft Excel or Microsoft Power BI can also harness the power of analysis services. We've alluded to some of the benefits of using analysis services, but let's take a closer look at what some of those advantages are. First and foremost, business logic can be incorporated directly into analysis services by customizing relationships between different tables. For example, per member per month is calculated based off member months and claim dollars, which usually exist in two separate tables. If you work with PMPM in relational data sources, you may be aware of some of the complexities that arise when trying to filter data by shared and exclusive dimensionality. Additionally, connecting to analysis services ensures a single version of truth for business users. So whether I want to analyze data in Tableau or Excel or a combination of both, I know that I will see the same results. Another benefit of analysis services is that security is role-based and can be customized based on who you want accessing the data. With member data being as sensitive as it is, this is crucial in the health insurance industry to ensure the right people have access to the right data. Finally, analysis services is superior when it comes to aggregations and is a powerful data engine behind the scenes of front-end reporting. When designed properly, users can expect fast performance to crunch millions of records, which are volumes that can be expected when analyzing claims data. While there are certainly other technical benefits of using analysis services, we wanted to highlight the benefits as they pertain to the business users in an organization. If you have any additional questions about analysis services and its integration with Tableau, please feel free to reach out to us. Keeping all of that in mind, we can move on to the second demo, where we will highlight self-service reporting. In this demo, we will showcase how using the same analysis services data source, you can create reports in Excel, as well as visualizations and dashboards in Tableau Desktop in an ad hoc manner. In both demos, we will emphasize how analysis services enables more users to explore data while ensuring all calculations, such as PMPM, are reported accurately. So with that, let's jump over to Microsoft Excel. So Microsoft Excel is a tool that many people are familiar with and use for doing analysis of data. We're using Excel 2016 here, but everything that we're showing can be done in previous versions of Excel. So Greg's analysis in Tableau helps me take a look at different costs against different providers within different states. But I actually want to take a closer look at specific membership populations. And while his reporting is really effective in a lot of ways, it's missing that piece of membership detail. So what I'm going to do here is I'm actually going to connect to analysis services and bring in some membership data in an ad hoc manner. I can do this by going to my data pane, and again, for the purpose of time for today, I've already made the connection here. So I'm going to select existing connections, select my health insurance model here, and I have some options to create a report, a chart, and where I want to do that. So I'm going to create a pivot table report right on this worksheet, and I'm going to start taking a closer look at how PMPMs are shown against the market for my internal members. So you'll notice on the right hand side here I have a variety of fields available to me. You'll notice some measures, charged amount, PMPM, as well as some more qualitative data, so age category, medical diagnosis category, and then some other things that are really important to know about analysis services, such as this MDC hierarchy. So if there's native hierarchies in your data, you can create these so that when your users are doing self-service, they don't have to worry about the hierarchies in their data. So I want to take a look at PMPM for different membership populations. So first I'm going to pull on PMPM charged to my values and market PMPM charged as well. And you'll notice these are automatically formatted to be currency. And that's actually some styling that we applied within the model, the underlying analysis services model. I can also start to bring on some different dimensionality here. So I might want to look at this by age category because I can see how specific membership populations are trending. So I can see that I don't have all data for all of these age categories, but I do have them for some. Another thing that's important to note is that market does have age category available in it, so that's why we see variance here in the PMPM charged. However, if I pull in something like marital status, I can see that actually my internal changes, but my market data stays the same. And this is something that's really important about bringing together market and internal data. The market data here doesn't, again, provide all of the detail that we have internally. So Greg alluded to not having specific member information or even specific provider information due to the sensitivity of it. So even though I'm looking at married and single here, my PMPM charge still comes through for my market, which doesn't always happen in a relational database. So with that, I can jump to kind of a more complete view here with some conditional formatting and additional filters. And I can see that I can add some color here to show that my PMPM is greater than my market. I can drill into those MDCs in a similar manner that Greg did, and I can also filter down to different areas. So very easy self-service in a tool that people are very familiar with, and some users in my organizations really like looking at these raw numbers. This type of analysis is perfect for them to get to that low level of detail that they need to. However, there are some users in my organization that want to use some more visual analytics. And while Excel does offer some visualizations and chart options, Tableau is one of the leading data visualization softwares. So I'm going to jump into Tableau Desktop version 10.0. Keep in mind that Greg showcased the server offering of Tableau, and we're going to take a closer look at the tool predominantly used for content creation. So for the purposes of time, I've already created a connection to my data source. Again, similar to Excel, and it is the same exact data source. You'll see along the left I have that qualitative and quantitative data, and I can start right away doing some of that member analysis. So again, I'm interested in looking at my PMPM charged, and maybe I want to look at claim count instead of market here, because as Greg mentioned before, where there's a high amount of claims and high PMPM, maybe that's a big pain point for me. So I drag these two on and I get a single bubble here, so I'm going to bring some additional detail here. And I'm actually going to bring on my state information, so some geographic information here. And I'm going to bring that onto detail, and now I can see each one of these bubbles represents a different state. So I can see that New Jersey has a high PMPM and a pretty high claim count, which doesn't surprise me because that's what I saw in Greg's data as well. I'm going to bring in a little bit more information here. So Greg kept highlighting the Northeast region, and I think that there's still some analysis to be done there on my members. So I'm going to pull region onto filter and filter down to the Northeast. And I'm also going to bring on a year to my filter. So I'm going to drag 2016 here. And then I'm going to bring on some more detail to this chart here. So I'm going to bring on age category to color because as I was looking in Excel, that's some information I have about my members. And now each one of these states is broken out by a different age category. So hovering over, I can see that, or I can actually use this legend on the right to highlight those specific points. Finally, I want to bring in gender to this whole visualization. So I'm going to bring gender onto my shape and adjust the size slightly here. And now what I can see is using these gender symbols here that I've preset, I can see that the breakout of males and females by state as well as by age category using different visualizations here. Similar to how Greg had multiple dashboards with multiple visualizations, I can take this a step further, and I've actually created a dashboard here that we can take a look at this specific visualization in the context of others. So if I go to this member analysis here, I see the chart that we've just created, and I see a couple other things. So at the top, I see a breakout of males and females by age category showing their PMPM. And the indicators here are representing where I trend above or below the market. So again, in 2016 in the Northeast, I can see that a lot of male and female populations are trending above the market. I can see there are a couple, 25 to 34, maybe they're a bit healthier here. But specifically, I'm pretty interested in this over 65 where I'm trending greater than the market and have a very high PMPM charged. And by clicking on this chart, my other charts below will filter down. So that scatter plot that was quite busy before narrows in on a few distinct points. I have this DRG details along the right as well, so I can start to see for specific gender and age categories what DRGs are most common and which DRGs are the most costly. So by selecting a point here, maybe I'm interested in New York because it's the highest PMPM and a relatively high claim count. I can see that my DRG details update accordingly, and I still have that comparison to the market here. I could take this a step further and start to look at my individual internal members to see if there's a reason that this age category maybe trends higher. But this is just skimming the surface of what's possible by giving users the ability to have access to the data or to the model. So that will jump back over to the slides and quickly recap. First, I demonstrated how you can create Excel pivot tables using an analysis services data source. And then I showed you how you can use that same data source to create a new workbook in Tableau Desktop to do more visual analytics. In both technologies, we reinforced that analysis services empowers more users to do discovery analysis while ensuring a single version of truth. So that concludes the demo portion of our webcast today. So I'll hand it back over to Greg to quickly wrap up.
Thank you, Laura. To reiterate the objectives that we covered today, first, we discussed the importance of becoming a more data-driven organization in the constantly shifting health insurance industry. Then, we demonstrated a few use cases of how health insurance companies can use market data to better understand their members and identify some cost-saving opportunities through both guided reported analytics and an ad hoc analysis. And then throughout everything we covered today, we shared how pairing Tableau and Excel with Microsoft Analysis Services can help equip more users within your organization with the tools they need for self-service analysis. Would you like to learn more about how you can enhance your current business intelligence solution to avoid falling behind the competition? Are you interested in equipping more analysts in your organization with the data and tools they need to make more informed decisions? Or are you currently facing any challenges when trying to analyze data from various sources in your current reporting solution? Or would you just like to learn more about how Microsoft Analysis Services can help get data in the hands of your business users to perform self-service analysis? If any of these apply to you, or if you have any questions in general, please feel free to reach out to contact either Laura or myself. So that concludes our webcast for today. If you have any questions for Laura or myself, please feel free to reach out via phone or email. Thank you for joining and have a great day.